Hey everyone, welcome to another edition of the Buddy Study Group. And today we have Miss Linda Tallheimer joining us for a study group session that I like to have her do once a year. I think it's super, super important. I think she's the best equipped to teach you about this particular topic. It's field underwriting, super important to us as long-term care specialists, super important to our referral partners that we do this and do a good job at this. So I know there's a lot to learn. I know there's a lot to learn from each other as well. So if there's anything in your journeys, in your travels that you think is a learning experience for the group, feel free to drop it in the chat. I think a lot of the times we learn about underwriting through anecdotes, so feel free to share. And Linda, you can take it away whenever you're ready. Thanks for doing this.
Oh, my pleasure. My pleasure. So, I always like to start off, why is underwriting important in doing your pre-underwriting with your clients? And there's actually a number of reasons. The most important of which is that when we submit an application, we really want to know that it's going to get approved the first time, right? And if that application gets denied, the chance of holding on to that client and having them apply again like drops at least 50%. It doesn't matter how objective underwriting is. It feels personal, it hurts, and people feel angry about this, right? They don't feel as sick as the underwriters feel they are, and they feel that this is always unjust. So you don't want to ever put a client in that situation if you can help it. And now sometimes our clients aren't 100% honest with us, and sometimes they really don't know their own medical situations. But the vast majority of times, if we do good underwriting, we know which company is going to insure them before we set in that application. So that's the most important. Secondly, it sets us apart from other professionals in the field. I can't tell you how many times somebody has called up the phone, picked up the phone, and said to me, yeah, I want to be honest with you. I'm talking with my financial advisor, and he's recommending, A and B or something like that. And I'll say, well, let's figure out what it is that you qualify for. I'll go through all the health questions, and then I'll say to them, did your financial planner happen to do any underwriting with you and ask any of these questions? Oh, no, the person usually says. And that, well, because the items that the policies that he's recommending, unfortunately, you're not going to qualify for. It immediately, sets you apart, right? Now, if, there are times that they do, but I can't tell you how many times I'm with people who do not qualify for the policies that they're comparing with me on the phone. So it gives you credibility to ask those questions. And the last and very, very important reason, another reason, is because if you set someone up and they get denied, they may not be able to get the policy that they would have qualified for had they not had a denial in their 1 year history. So we don't ever want to prevent someone from getting something they could have gotten if we had done a better job of underwriting from the start. So what I'm going to do is I'm going to share my screen, and I'm going to take you to my website because I think this is the easiest way. And then you can access this information on your own, and I think it will make it very easy for you to have the information that that you need to ask these questions. Okay, so this is my website. All right, so you can go to longlifeplanning.com, and at the top you'll see long-term care questionnaire. So this is what I say to my financial advisors, to clients who come to me. If I'm more than excited to meet you for our first meeting. Here is a calendar link, schedule a time, or we might schedule a time right on the phone. And then I'll say to them, if you want me to come prepared to that first meeting with quote options, I'm going to ask you to complete the long-term care questionnaire on my website. It is HIPAA protected. So if anyone has a question about the questionnaire, I'm asking about financial and health questions. This is a HIPAA protected long-term care questionnaire. And just as a reference point, it costs about $100 a month to have a form HIPAA protected. Okay, so they go over here and they click on my HIPAA compliant form, and then we have all the questions that I feel will give you enough information to be able to actually start making quotes right then and there. So we get the basics of the name, and in order to get through it, I just have to put in something. So I'll just put in my name, okay, and then we'll put in an address, and then we'll put in a town and a little zip code. So there's some things that they have to fill out to get to the next level, and we'll just put in a phone number here. All right, and then we put in an email. Since this is being recorded, I think I'll use the one from my website, which is what is my zip code? How about my 321? Oh, that's it. Okay. And then they fill in their date of birth. So it can be anything, right? So 19, they could pick a date, they pick a height, they pick a weight, and then it asks them if they have a spouse. So with this, I was able to set it up. So if they say yes, it says we could like to consider a shared policy, including your spouse or partner. And if they say yes, it will say, please have your partner complete a questionnaire as well. Okay, so they can, so you're setting this all up before you even come in. Then I go into the health questionnaires. Have you had a physical and a full panel of blood work in the last 2 years? Because that is often needed by these insurers. And if they have, then we need to know, were any of the blood labs outside the range of normal? And that's the easiest way to ask a general question. Is there anything wrong? Because that will tell you about thyroid and cholesterol and liver function and kidney function. It tells us so much if any of these things are outside the range normal. If they say yes, then a little chart, and we have them put in the information that they have. Otherwise, they can keep on going. Are there any medical appointments or tests pending, including those that still need to be scheduled? Because oftentimes we know that people don't consider anything pending if they didn't make the appointment, right? So they just went to the doctor, they just find out they need to have this test, and they think, oh my gosh, I got to get long-term care insurance before I find out the information on this test. Too late. If the information, it's already in the medical record, they're already pending a test, they have to complete the test and have the results before they apply. So you want to know that ahead of schedule, right? And so, canceling appointments is not the answer to this question. And then we want them to fill in all of their medications and when they're prescribed and why they're taking them. And then here's a question. So basically, a lot of the questions on this is based on a sticking point I had in the past. So have you been prescribed medications that you choose not to take or stop taking without your doctor discontinuing the recommendation or order? There are many people out there that self-manage their medications, and they're on a medication and then they say, oh, I don't think I need it anymore. And they stop taking it. It doesn't mean it's discontinued. And insurance companies like compliant patients. So you can't have clients discontinuing their own medications because they don't need them anymore. It needs to be discontinued in the medical record as well. So if you get an answer like this, you need to say to them, they need to talk to their doctor, make sure their doctor agrees that they shouldn't be taking this medication. HIV or AIDS, all the the big items of ALS, cystic fibrosis, Parkinson's, schizophrenia, lupus, if they're using any adaptive equipments, if they are receiving disability benefits, right? Oops, I have to put no's in all these too. See, otherwise, if they don't fill in the answers, they get these red lights. Oops. It says you have to fill them out in order to get to the next page. Now we're going to talk about family history, because we know that family history, especially with regards to Alzheimer's or dementia, if you have 2 parents who have dementia and they're young, the only company, there's only like one company right now that I know that's in a traditional type of hybrid that will insure them. And you keep, depending on the age at which they have dementia. So once you know that a parent has dementia, you want to know at what age were they diagnosed. If it was over 80, it's not as big a deal. but if it was less than 80, it's a big deal. And the younger they are when they get diagnosed, the more important it is to the underwriter. Have you had an MRI in the last 5 years? That really opens up a lot of information to you, because if they have, then you find out why. And if it was due to headaches or usually like like a bump in the head or anything like that, you've got to ask them, you got to go back to that report and see if there are white matter changes. Many of the companies don't care about white matter changes, but many of them do. And so if there are white matter changes, it is an automatic denial by many of the companies. And if you're over 50 years old, you can have, these idiopathic white matter changes that the doctor says mean absolutely nothing, but some insurance companies just don't want to see and insure. And you can even have it in very young people too. I had a 35-year-old who had white matter changes in the MRI. Okay. And if they have an MRI, it also gives you an indication of back issues, right? Because you typically have them for the head and for the back, and then it guides you along that next path of, so you had the MRI, what did it show? Was it mild, moderate, severe? Did it show degenerative changes? And it gives you more and more information so that you know how serious each diagnosis is. We talk about the smoking, right? And marijuana. We talk about gummies, right? We don't want to ignore gummies versus smoking. They are different by different underwriters, but you need to know which one it is. Cancer, and if they've had cancer, then it breaks it down. Is it metastatic? What type of cancer? When have you had it? What type? Strokes, falls, mobility issues, breaks in the last 2 years, right? Bones breaking are a problem if they're in combination with osteoporosis. So while somebody says, listen, it was no big deal, I fell off a bike, anyone would have broken their bone. But if they break a bone and they have osteoporosis, it doesn't matter how that break happened, it's still a break and will eliminate them from some policies. Other chronic illnesses, arthritis, atrial fib, chronic bronchitis, COPD, diabetes. I'm really trying to just pull in many of the other diagnoses here. Sleep apnea. And if you do say yes, it will ask, do you use a CPAP or other device regularly, right? So, and so that's important to understand. So having sleep apnea isn't a problem as long as they are following the doctor's advice to manage sleep apnea. If they are not, it will be a denial. Sleep apnea is not a benign thing. It can cause strokes. It can cause dementia. Cortisone, right? So cortisone injections. Most companies will require at least 6 months past a cortisone injection before they get insured. So you want to know if they're getting cortisone shots, when did they have them? How frequently do they have them? Do they have another one planned? And where was the injection? So there are some injections that are not as critical as others. Back injections are obviously much more significant than knee injections and hip injections or shoulder. PT. There are people who use chronic PT as a coach and massage. So it's important to ask the question: Are you engaging in physical or occupational therapy in the last couple of years, and why are you using it? And so I've had a number of people who've been in physical therapy, and it was for their benefit, not because it was really medically necessary, but it was a medical choice. And we now have policies that you can apply for that allow you to stay in physical therapy, but it may not be the ones they want. And then it's their choice whether they want to have the medical records identify that they're discharged, no further treatment is indicated, no follow-up is needed, and they can return completely to all activities with no restrictions. Of course, we have to address history of alcohol or drug abuse. I mean, it's prevalent out there, and there are a lot of people who have had histories of alcoholism and drug abuse, and we need to be aware of it because that is also a potential for a denial. Now, depression and anxiety is important to understand because we need to understand what the treatments for them have been. So ECT, electroconvulsive therapy, for some people, it feels like a complete cure and no medications. So if you just look at medications, it will look like they've never had anxiety or depression. But if they've had that treatment, they will be a denial, except in a simplified issue where they do not ask those kinds of questions. They do not worry about anxiety and depression. But that is that. So you have to understand if it's a major depression, many of the companies are looking at major depression, and they don't look at it in the same way. And major depressions are still insurable by many of the carriers that did not insure these people in the past. So this is not as big a deal, but you still need to understand it to make sure that you're choosing the right company for the right person. And oftentimes it's a combination, right? So if you have fibromyalgia and anxiety and depression, it's more of a problem than if you just had fibromyalgia or anxiety and depression. Okay, so the combination can be a denial. Any residuals from COVID or Lyme disease, right? That we all know that those can be significant, and then you need to understand them. This is a big denial area. They're considered like autoimmune diseases. Have you ever had any health issues? And this is sort of like the final, like trying to wrap around anything that we've missed. Are there any other health issues, surgeries, or treatments not mentioned above in the last 3 years? You know, and so those are the basics that I ask for health. But if we're planning, we also want to know all these other things. And you can get all this when you're doing your health, you might as well do all the financials. So I ask if they own a rent. I ask what the value is of that house is. I ask if they have a second property. I ask what state they plan to retire in. I ask what other insurances they have. If they have an annuity or life insurance, we may be able to do 1035 exchanges. We want to know the approximate value of their assets, because we will start thinking, 10 pays, 5 pays, single pays, or we will be looking towards short-term care if it's very small. We want to understand the motivation behind these so that we can really remind them as we go through the process, the value of the insurance. Who are you leaving your assets to? Is it important to leave them? And who is it important to leave? To children, to a charity, other family, or I don't really care. I don't need to leave them to anybody. And that's fine too. Self-employed or a business, because if we're self-employed, of course, we can start talking about tax deductions, right? We ask about annual income, because we might be able to just get a nice 10 or 20 pay out of a nice annual income. If they have an HSA account, again, we can talk about tax deductions. And then I ask this question, which I think is really helpful in your presentation, because, when you're trying to put together quotes, you want to be able to guide yourself around what is going to be most meaningful to this individual client. On a scale of 1 to 10, what is your level of concern that you may spend the premium and never need care? Right? So if they say, 5, might be not a big deal. It's not a big deal. You can think, you're going to show a little equal between traditional and hybrid. But if they say they've got a 9, that they are concerned that they're going to spend the premium and never need care, I might show one traditional policy, just to give them a cost benefit of maybe a shared individual policy. But I would, if it's a single person, I would just go straight to the hybrids. I wouldn't even bother with the traditional, right? Because this is a big deal. And if you were to take a guess, this is helpful, because if you're going to show products and compare them beside each other, you need to know at what point you're going to compare them. You have to pick a time and space, right? So do they think they're going to need care before 80, between 80 and 85, 86 or 90, or older than 90, right? Because that's going to give you an indication. If they think they're going to need care at age 80, then 3% looks, it's going to look much, much better. If you're talking about somebody who needs care older than 90, 5% starts to look really good on even a lot of these traditional policies. If you need care, how many years would you want to be sure that you could afford to fund? Because we can make all the assumptions about averages and statistics, but it really comes down to the individual. But don't be surprised when they change their mind. So if they say 1 or 2 years, you still want to show them the 5 or 6 years, because I can't tell you how many times I'll put out a 1 or 2 years because they said 1 or 2 years. And I said, well, what happens when I run out? Well, you told me you only needed a couple of years, right? So, and the cost benefit for long-term care is certainly in the longer policies. So we definitely want to show those longer policies as well. And then I don't know how many of you have ever seen Say Yes to the Dress, but there was a concept there that was very, very important. And when they came in and they asked people, how much do you want to spend? If somebody said less than $5,000, the salespeople would never show them anything over $5,000, because they knew they'd fall in love with that $6,000 dress and they'd never be able to afford it. And then they left with nothing. So in some ways, long-term care is like that as well. They may say they want to cover 10 years of long-term care 100%. Well, we all do, but the premium isn't going to fit almost anyone's budget at that level, right? So we need to know what is their budget, because any leveraging of long-term care is going to be a value, and it fits in their budget, then they're going to be much more likely to say yes to the plan. And you can always throw in one, if you want to, but you can always go up. It's much easier to say to someone, oh, it's not, you want more. We can add more, right? Going down is harder because it feels like a loss. And then we want to get the other pieces of information that are going to be very helpful for us to hold on to the business and to separate us from other professionals. Have you looked at long-term care insurance previously? And if you have, you say yes. Oops, it didn't pop up. It should have said, I checked that one. It should have said, and what prevented you from purchasing it at that time? But you can always ask them that, right? And are you presently looking at long-term care with another source? Important to know. Are they looking at with their financial advisor? And if they are with their financial advisor, or they're looking at with another person, you need to ask the question, do you have a special relationship with this other person such that you would feel the obligation to purchase the insurance from them? Because if the answer is yes, then he dutifully say, I appreciate you reaching out, but if you have to buy it from them, then you really need to get the information from them, right? So, but if, but we can do splits, we can work with your advisor if you'd be interested, but it's very frustrating, as we know, to do all the work and then they say, oh, my advisor can sell the same thing, and it goes to the advisor. And relationships are like that too. I just spent a long time with a woman, and she canceled her appointment to actually purchase. So we had 2 meetings. We're on a third to actually sign the application. And she said, I changed my mind. I'm going a different direction. So I wrote, was it too expensive? Was that the concern? And she says, yeah, it was just too expensive. So then I pushed a little bit more. Well, we can always go lower, and let's talk about a more affordable policy. And she says, well, to be honest, my husband has a friend who sells long-term care insurance, and I have to buy it from him. My husband wouldn't understand if I didn't buy it from his friend. So relationships, you cannot fight a relationship, most of the time. So, you only have so much time in the day. So you want to focus in on the ones who really are going to appreciate your help and value you for your help. Let's see. And have you been declined for long-term care insurance in the past? Oftentimes they have just been declined, and now they're looking to find somebody who can do better than, for them. So you need to understand why they were declined so that you can see if there's another fit. And there are absolutely options for them. Now that we have denials, we have so many simplified, and we have a guaranteed issued product for clients that there's really, depending on financials, there's nobody we can't help, which is very, very exciting time in long-term care. And then it's always nice to know who actually referred that person to us so that we can thank that person and appreciate that person so they can give us more referrals, right? So this is on my, I brought it up here so you could see. So if you have questions, you want to play with it, you want to share these answers and, and create something of your own, feel free, right? It's all about, sharing and making sure that you're helping your clients to the best ability that you can.
Yeah, I just have a couple comments.
Yes.
This is pre-qualification. I mean, there are so many unbelievably thoughtful questions. And what that boils down to is, yes, Linda has a lot of experience in the long-term care industry, but if you took note early on as she was going through the form, it was many of these questions were added as the result of a snag that I went through in a previous case. You can learn and create something wonderful from, a career of many things going right and a couple going wrong, right? And as long as you learn from it and apply it to your practice going forward, that's the most important piece. So I think what Linda said there was super, super important. Um, and every piece of this form helps Linda plan for the client, in ways you might not have thought to ask the client up front. But beyond just helping her plan, what it also does, the client comes into the meeting with a far better idea of what they want out of this planning process as a result of going through the form too, right? There's a lot of questions like, when can you see yourself needing care? If you see yourself needing care, how much care do you think you might need? Um, you know, budget, everything else. It forces that thinking exercise in less of a pressurized situation. You have to think of it in the moment when you're sitting across from Linda on the first meeting, right? So I thought that was really, really good. And then just one other comment, I thought, the fact that you can collect all of this information, but understand the client might change their mind, right? You're going to show them things that are going to have an effect on their initial perceptions, right? So, yeah,
Mhm.
it's a great form, great form.
Okay. And do you want to, yeah, so you showed them how to get it. So you just go to my website and you can copy it right from the website. I don't have a copy of it actually because I did it on, I mean, I keep sending the questions as I add questions. I just send a question and have it go into the the um the designer who put it into that form. And she keeps
It looks
adding.
like a job form
It is a
to
jot
me.
form. It
Okay,
is a jot
yes.
form.
So
Yeah.
Jotform is something that we're familiar with. We used to use Jotform quite a bit until we moved to another solution, but Jotform has an excellent HIPAA compliant version of their form builder. Very, very easy to work with. Very easy to notify yourself whenever anybody fills out a form. All sorts of stuff you can do with that on the tech side. But the HIPAA compliant piece allows you to electronically collect those things.
Yeah. I see that Steve said that, it seems quite lengthy for a first visit. Well, it's up to the client, right? So I always say to them, if let's plan a time to talk, but if you would like me to come prepared to the meeting with quotes that are appropriate, then please complete this questionnaire because without understanding your health and finances and motivations, it would be impossible for me to provide appropriate quotes. So never feel uncomfortable. You'd be surprised. Every person fills this out, and if they're referred by a financial advisor, the financial advisor sends them. They either send them to me, and then they send the form, or the financial advisor sends them the HIPAA form, and then once I receive the HIPAA form, then I send them the link. But I'm trying to think of this. Um, it's very rare that when I send both the Calendly link, and my Jot form link, that they come to the meeting without having filled out that questionnaire first. And now I'll say this, and sometimes they don't fill it out to the level of detail that I'd like, but it gives me, and that tells you how sold on the idea of long-term care, how open they are at the beginning. So some of them, they'll just go through and they'll fill it in, but they won't fill in the details. So the detail part is not, I used to have it mandated, and I said, you know what? I'm going to leave that optional. So if people, when it says, you don't actually have to put in the details about your medications. You just have to put in, the type of the medication or what it's for type of thing. Um, and and so if you say, yes, I had a stroke, and then it says, then you get in a box, please tell me about it. If they don't fill it in, I don't know anything about the stroke, but I know they had a stroke. And then I can start the meeting with some, general information. Or sometimes what I'll do is I get it, and then I'll say, thank you so much for completing the questionnaire. I noticed you mentioned you had a stroke. Could you give me a little bit more information? When was the stroke? Do you have any, long-term effects from the stroke? Are you on any medications for the stroke? So even if they don't fill it out completely, they do answer the questions before you get to the meeting.
Yeah, and I feel like it's where do you want to save the time, right? Up front in a way where you can actually fully assess a client's skin in the game and, really get yourself a lot of information that will help down the line, right? It makes filling out the pre-qualification form to send to a carrier easier. It makes pre-filling the application easier, more complete. There's a lot that it can save you down the line. It is a lengthy process, but it's like, when would you like to go through this exercise? Because it's going to happen at one or multiple points of the process anyway.
Think about it. It really only took, it's only 4:34. We started, a little bit after 4, and we've been talking for a couple of minutes, and we had an introduction. So maybe 20 minutes it takes them to complete a form. Yeah, that's that to me, that's very reasonable. To this is an important product. It's an important protection. If they don't have 20 minutes to put into completing a questionnaire, then they're probably not that serious.
I think it's also the nature of online consultation today, a lot of the times. If you're doing anything, um, you know, telehealth related with a new doctor's office, a new specialist, you have to go through quite a questionnaire. And
Yeah,
oftentimes it's like one question per screen for 20 to 30 minutes, right? So
yeah.
don't discount how familiar people are with this sort of process when you're meeting a new professional that really needs this information to be able to
And
move
I think the
forward.
HIPAA aspect of that questionnaire is critical because
Yes.
it reminds people that you are protecting their information, that they're not putting it in a form in the middle of the internet to go around the world, that it is a HIPAA protected form, and so it's safe to put that information into that form.
I think it also certainly helps that you work with a number of warm referrals,
It
right?
does.
So
It
if
does.
you
Mhm.
if you work with referral sources, it's as important as having something at the front end of your process like that your referral sources, your referral partners are trained on the importance of that so that they can convey that. And that really helps break down kind of the initial barriers. If you're working with cold lead sources who don't know much about you, have not necessarily been referred to you in a traditional way, they may see that questionnaire and say, I don't even know this person. Number one, am I going to give them all this time? But number two, am I going to give them all this information? I think at the same level of commitment, how well you can trust whoever's referring you to Linda or Linda herself from anything you've seen from her matters just as much to that. Karen said, we found many people are more forthcoming on a form rather than in person visiting. Now that's also a pretty interesting dynamic because there's no, I'm not sitting here for you to perceive me judging you, right? So that's also a super, super good point.
Interesting.
Um, so Linda, I know you've collected a ton of underwriting anecdotes over the years, but what have you seen very recently cropping up for you? Maybe a recent addition to your form. It might be recent case studies you're dealing with in a case. And after you answer that, I'd love you to talk a little bit about medical records because you're a bulldog with medical record receipts, research, and expedition of that whole process. So I'd love to hear from you on that too.
Yeah, so I would say probably the one that's popped up more frequently is fatty liver. And the first time you almost had a laugh, like what is fatty liver, right? But it seems to be related to cholesterol and the way we eat. And you don't have to be overweight to have a fatty liver. But fatty liver is a denial or even a rating, depending on the level of your fatty liver. And so, it seems like you sort of get things in patterns. Like you get one, and then a few of them that keep cropping up. So that would be one, and that is actually answered in that question of, do you have any lab values that are out of the range of normal? And that would show up in that out of normal range. Kidney functions also, but I don't see as many with kidney function issues. But you'll also find anemias with that question. Any values out of the range of normal. Anemias are one of those things that would be caught in that lab testing. And you don't always think about, you don't want to have to ask every single question that's on a lab test, right? So it's a very easy way because everyone's very proud of all of their greens and they're very aware of when it turns red, right? So they know which ones are out of the range of normal, and it's usually, hopefully, it's only one or two. So they're really pretty quick to pull those out and let you know what they are. 2 week sugar fast starts to reverse fatty liver. Okay, well, who knew that?
And that's what I've always liked about field underwriting and underwriting in general. You actually learn quite a bit from the world of medicine and what people are dealing with in their day to day as part of this. I think it's just an interesting, human interest piece of working in this business. I really liked understanding the details, what we could do with them, what these things kind of meant. And it's even more interesting when you compare it against, underwriters from a profit-seeking insurance company versus a doctor's assessment of your health as their patient. And I think the important thing is getting clients to understand that there's a huge difference there. That's what kind of curtails the emotions a bit. It will never completely, but that's one thing that I think is important to point out in the consultation. Your doctor's assessment of you as just a human being is so different compared to a profit-seeking insurance company's view of you as a risk, as an investment risk, essentially.
Exactly. Doctors don't want to make people nervous. I mean, there's no point in saying, your blood tests indicate that in 20 years you're going to have kidney function, your kidneys are going to fail. I mean, what doctor is going to say there's nothing we can do about it, so just worry about it for the next 20 years? They're not going to say something like that. So if their kidney functions are out, or the liver, and there's nothing they feel they can do, like there's no medical action in that moment, it's fine. They're just going to wait and see. And when it's a problem and there's something they're going to do about it, that's when they'll discuss it as a problem, which is why the doctor will often say it's not a problem, but the insurance company is looking into that future world of what happens in the future. I think the other diagnosis that I found out about the other one I was thinking about is aneurysms. And I actually have to add that to my questionnaire because aneurysms have been really big lately. I don't know why, but I've had a number of people who have had too large an aneurysm and they're not operating on them, and the insurance companies don't like them, because they can blow, they can be a stroke, they can die. And when I look at some of these numbers, now that I'm getting more aware of the size of an aneurysm, and I mean, I look at some of these people and I'm thinking, oh my gosh, I mean, this is terrifying. I understand why the doctors doesn't say anything to the patients because they're terrifying and sometimes they can't do anything about them. So that will be one other thing that I probably will add.
Yeah, and there is like a, doctor patient sort of intimate relationship there, which leads to things being said the way they are. But also, even if your doctor is going to go a little farther than saying it's fine, right? They will say
Right.
something along the lines of it with certain conditions. You know, the human body has an incredible ability to regenerate and recover from things if we treat it right. An insurance company is going to say, I don't care about that. Look at what it says on the paper here. You know, I have to pay for that if something gets worse with that. I don't know this person beyond the specs, right? So I think the more you can kind of explain that line, the more comfortable people get and the more people can distance themselves emotionally from that. But yeah, I am also interested because you are a scholar and storyteller of wacky medical records stories. And what goes down in medical records can be surprising to basically everyone involved. And I know for many, there have been scenarios, unless somebody conked me over the head with a hammer, I didn't live what it's saying on this paper, right? And anything else in between.
Yeah. There is a very, just to give you an idea of how bad medical records can come out. I had a woman who went to the emergency room for, very bad back spasm. So her medical records read, arrived in a wheelchair, prescribed one of those narcotic medications, and then discharged for follow-up or something like that. I can't even remember what it was. Severe back pain, prescribed narcotic medication, and discharge. So obviously she was denied. She was in a wheelchair, right? She has only been in a wheelchair from the front when she entered the hospital to the room of the doctor's office in the emergency room. Because when she got to the doctor, they put her in a wheelchair. They brought her to the doctor's room. And then she walked out. And she actually never took any of those narcotic medications because when she understood that it was just muscular, she figured she would stretch it out and she didn't want to take a chance at taking narcotic medication. She said she'd be happy to count them and send them back to the insurance company to show that she never even took the narcotic medication. But here it looks like she's like this absolute disaster. And it was an acute back spasm and the way it was recorded in the medical record.
So how
Um,
does somebody go about trying to right those wrongs? I think that's very important for people on the call who haven't, run into that scenario before, or maybe not enough.
Yeah, it's actually not as difficult as you think. I mean, sometimes I should say, if it's a true error like that, those errors are easy to be rectified because they go back to their doctor, they go to their orthopedist, and they explain. The doctor puts a note in, this was a misunderstanding in the medical record. This client, this was an acute event. She was only a wheelchair from here to there, and she never even took the narcotic medication. She did exercises and she recovered. But we have people who, somebody checks a diabetic in the medical record, and that can be a problem. We've had somebody who has the wrong medical records. I had a client who was declined for um, concussions due to football injury in college. He never played football in college, right? So these are easy things to rectify. It's just, but you need to understand why they are declined so that you can remediate them. I always tell people to check their medical records before they go out. Is there anything in your medical records that you should be concerned about? Sometimes they'll tell you that they've done something and it turned out that there was not, that it was they had something years ago, but everything's fine. You want them to go back and make sure it's actually been expunged or it's no longer in the medical record, right? That it's no longer an issue. I'm going to start I just want to mention one thing because we're all in the business of selling promises to our clients, right? So medical records are very, very critical. And on the front end, doctors tend to put in every piece of information. You stub your toe, it's in the medical record. But for whatever reason, as clients age, doctors don't like to write bad things in medical records they can't fix, sort of like the kidney disease. They're not going to say, oh, it's a terrible thing because there's nothing they can do about it. They don't like having problems they can't fix. So as people get a little dementia and they get a little balance issues and stuff like that, they don't always write in the medical record. In fact, it's very rare they write in the medical records until it's absolutely critical because they can't do anything about it. So it's not a medical issue that needs to be addressed. And so when people go into claim, medical records are often grossly inaccurate and underwhelming relative to what is actually happening in the home. So educate your clients when you sell them these policies and explain to them that when there's going to be a time that you will likely decline, which is why you're buying these policies. And when that time happens, make sure your doctor is documenting in the medical record, because their word is as important as a medical test. So if the medical record says family reports client is leaving the refrigerator open, family reports they're not using their cane, family reports leaving the stove on, wandering, getting lost, tripping, falling, any of these things, that is part of the medical record and helps in the claims process. So remind your clients that when they go into claim, there needs to be a medical diagnosis if there is one, or it says an idiopathic, we don't know why, but these are the symptoms, and this is what it is causing. So medical records are very important in underwriting, and we want to have as little as possible in the medical record in that area. But when they go into claim, we want as much information as we possibly can. So educate your clients to get that medical information into their records as they are declining in older ages, so that it is clear and unambiguous when they go into claim that this is a legitimate claim and it should be fulfilled efficiently.
That's huge. Yeah. And Suzanne asked in the chat, and we'll go through 2 anecdotes that people put in the chat. Thank you for those. How can clients check their medical records before applying? Do consumers have access to something like a Milliman?
That I don't know, but what they can do is, so most of them have the online portals, so they can at least check their diagnoses, and they can check their medications, and they can check their tests and their test results. So all that is typically in their portals. And most of them have summaries from their last visit.
Yeah. And if your doctor uses like text to speech or anything else to make any appointment notes, probably not a bad practice to check it if you're going to be applying for insurance.
Right.
Let's see. So Jackie had a case study on osteoporosis. I had a client that had 2 fractures, one from a broken leg due to skiing, and another from slipping on water in her garage, along with a broken toe after being stubbed. After the broken leg, they did a bone density test, and she had mild osteoporosis. The underwriter is willing to look at the client due to the fractures being from traumatic injury and not due to disease. In the review, they did ask me if the doctor did any blood clotting disorder testing, answered no, and they stated to submit an application. So
Good.
That's interesting. And, it's, I may sound harsh to insurance companies when I say, your doctor will say this is fine, or you can recover from this, or with good habits, you can get better. And the insurance company may not care about that in all scenarios, but they do care about the little idiosyncrasies of certain scenarios. Is it traumatic injury, or is it a more natural causes? Osteoporosis is one of those really good examples.
And osteoporosis is a very wide range. So when you say mild, remember it's like negative 2.5, right? That puts you into the osteoporotic area, right? So if you're negative 2.5, then you're osteoporotic. If you're negative 2.4, then you're osteopenic. So, so the question is, if there was mild, it's so close, that you might have more leniency. If you're negative 3 and you have a fracture, the chance of that underwriting is going to be much more unlikely, right?
That's right.
Mild in these illnesses, there may be a little bit more play.
Mind your T and Z scores. So Diane said, I had a client who was declined for kidney failure, and when she asked her doctor about it, he said he didn't want to worry her. Amazingly, she recovered over 8 months and was later approved for coverage. I think that's a really good one. That can be tough to get over the hump in any way, shape, or form. Anybody else have any questions, comments, thoughts? I appreciate people sharing in the chat and asking really good questions. And of course, yeah, Linda, I'll
a very
pass it to you.
important thing I forgot to tell people.
Yeah.
half the United States are on these new weight loss drugs.
Mm,
Okay, so
GLP-1s?
this is the way insurance companies, many of them are looking at it. Weight loss lost within the last year due to a weight loss drug is going to be calculated at half of the weight loss. So if they lost 50 pounds in the last year, they only lost 25 pounds. Anything
Mm,
over the year isn't full weight. So when you're so if you ask somebody their height and weight and they look good and you find out that some of that weight was lost within the last, if they just make it to just at that point at which they qualify, and that some of that weight was lost in the last year, they're going to get denied from some of these companies because only half of the weight within the last year will be covered if it is a new weight loss, especially with these new weight loss drugs.
perfect. Yeah. And that's really on the underwriter side and on the agent side. It's so important to like pay attention to these medical trends. If you're seeing, if you're watching TV or the news, whatever it may be, and you can't stop hearing about one thing or the other in the medical field, there's a chance it will probably make its way to your carrier's underwriting guide or at least their internal guides in the near future. And you got to dig into that stuff and understand what it means because if you're dealing with Americans in long-term care planning, you're eventually going to run into it yourself. Yeah, there may be some lag time, but it's going to come eventually. So just kind of staying on that cutting edge can really help you be a good field underwriter too. So I think since we don't have anything else in the chat, I think this is a great spot to end it on. Linda, I remember in previous years when we've had you do this study group, you had a one pager, maybe a two pager actual document. Now to see it as this electronic form that you very diligently put together, even over the last few years, but using all of your experience has been a cool thing to see. A lot of really good takeaways for folks if there are things that you see on that form that you feel like you would want to add to your own. Linda's always happy to share. Just go to that link and you can feel free to just kind of like test it. Like, don't actually um, blow up Linda's website by submitting the questionnaire itself, but you can go through, take a look at the questions and see what inspiration you can draw from it. I guarantee you it'll make you a better field underwriter at any level of experience. So thank you very much for the time, Linda. Everybody seems to have really enjoyed it too. So
Good.
I am glad I ask you once a year to do this topic because it's always helpful.
All
Thank you,
right. Well,
everybody.
take care, everybody.
Be well. Talk to you soon.